All right, good morning. It's Senate Health and Welfare, Wednesday, April 15th. Okay. And this morning we're looking at H 938, the really big, very big bill of Vermont homelessness response. And we're starting out with Deanna John. Thanks for being here. I know you have a schedule.
Appreciate the flexibility. Thank you. Good morning, Chair Lyons and members of the committee. My name is Deanna Hartog, and I'm the Poverty Law Fellow at Vermont Legal Aid. I really thank you for the opportunity to testify on H 938 today. I want to start out by saying Vermont Legal Aid really appreciates all the significant work that's gone into this bill and the legislature's commitment to building a more coordinated and thoughtful response to homelessness. This bill, while imperfect, represents a meaningful improvement over the status quo. We appreciate the legislature's willingness to engage seriously with these complex and difficult issues, and we support continued work on this legislation. We share in some of the concerns that other advocates will testify about today. And those include concerns about the tiered shelter structure, the risk of segregation of people with disabilities, conditioning shelter on treatment, conditioning shelter on participation in treatment, the breadth of the termination provisions, the mischaracterization of permanent supportive housing, and the removal of the category for households experiencing catastrophic loss. We would welcome continued conversations with the committee on all of those issues. But today I want to focus most of my time on section 2215, the appeals section, because we believe it is essential to the integrity of this bill. As the committee heard last week, the agency has proposed striking this entire section, and we are very concerned about that proposal. We acknowledge that even if the appeals section were removed, that some decisions might still technically be appealable under existing law. But removing section 2215 would eliminate due process protections that ensure that the system works predictably, transparently, and fairly for everyone, for households, for providers, and for the state. So first, one of the most immediate consequences of removing the appeals section from this bill is that households would lose their ability to remain housed pending appeal. Under the current existing framework, households can ask to be housed while the appeal is pending. A hearing officer then makes a determination based on case-specific factors on if the agency is required to keep the household housed during the appeal. This protection is really, really critical. Appeals take time. And if there's a clear error, the household shouldn't be unhoused for the entirety of the appeal. As section 2215 is struck, then we'll return to a deeply harmful and cruel reality. If a household is terminated improperly, they end up back on the street before the appeal is resolved. Due process after someone has already lost shelter is not meaningful due process. If this bill is intended to reduce homelessness, which it is, it must not inadvertently increase unsheltered homelessness by eliminating the ability to remain housed during an appeal. Second, the bill has to clearly define how appeals function, especially when community providers play such a central role in the homelessness continuum. Community providers are essential partners in the system. They bring expertise, trust, and deep commitment to supporting people experiencing homelessness. For that reason, it's so important that the bill clearly establish where the legal responsibility sits and how disputes are resolved. A potentially workable and collaborative approach would be to provide that when a household seeks to challenge a decision made by a community provider, that grievance is then reviewed by the agency. And then the agency would then either uphold or reverse the action. And the agency's decision, not the provider's, would be appealable to the Human Services Board. This type of structure that I just mentioned preserves the collaborative role of community providers while ensuring that the final determinations rest with the state, where legal responsibility properly belongs. It also provides a clear, navigable appeals path for households and avoids confusion about roles, process, or order. Third, without a clear and accessible administrative appeals process in statute, the only remaining way to challenge disputed decisions made by community providers is through affirmative civil litigation. And that outcome serves no one well. Litigation is slow, expensive, and highly burdensome, not just for people experiencing homelessness, but also for community providers and potentially for the state. It diverts limited resources away from service delivery. It places strain on already overextended nonprofit organizations, and it introduces delay into situations where time is really critical. An administrative appeals process offers an accessible, efficient alternative. It allows disputes to be resolved quickly and consistently without forcing parties to expend scarce resources on court proceedings. Fourth, clear notice requirements are really essential to due process. Courts have recognized that emergency housing is a protected property interest, and recipients of this benefit must be awarded constitutionally sufficient notice before that housing is terminated. Recent litigation, including the Groundworks case that Vermont Legal Aid is a party to, reinforces the need to write these protections directly into statute so that they are consistently applied and understood by everyone in the system. We notice that appeals requirements are left to policy or practice rather than law. They become contested, inconsistently applied, or not provided at all, often already after irreparable harm has occurred. And finally, I want to express our strong appreciation for the provision requiring the agency to adopt Human Service Board interpretation after 20 substantially identical decisions. This language addresses a system failure that we saw happen last year when hundreds of households were forced to appeal the same legal issue. At Legal Aid alone, I was helping more than 60 clients with their appeals at one time. We eventually had to decide to only give pro se advice because our organization didn't have the resources to help with hundreds of individual appeals. This provision promotes consistency, fairness, and efficient use of resources, and we strongly urge the committee to do that. So in closing, the appeals section of H 938 is essential. It assures that this continuum operates fairly, predictably, and constitutionally, and that households are protected from harm while disputes are resolved. We strongly urge the committee to preserve section 2215 in full. Thank you again for your time and for your consideration, and we appreciate your work on this legislation and would welcome the opportunity to continue working with you to improve it.
Thank you. So 2215 is something is including the time. So,
Sorry, and
including the time.
the appeals section which lists out, yeah.
Thank you. Thank you. Right.
Thank you.
I need a voice. I need something. Okay. So now you can start.
Do you have a PowerPoint? Is there a way to connect my computer or do you have it up on yours?
Yeah, you'll just join the Zoom.
Okay, share it.
And did you send this to us also?
I see it. It's Monday evening.
Got it.
Do you mind holding the Zoom?
Okay. If you want to start by introducing yourself, sure. And get that up.
Yes, thank you. Good morning, Madam Chair, committee members. My name is Kathleen Burke. I'm the Executive Director of the Vermont State Council Authority. Joining me today is my colleague Elizabeth Bacon, who is our Managing Director of Housing Program Administration. Essentially, she oversees all of the rental assistance programs administered by the Vermont State Council Authority. Thank you for the opportunity to come in today and talk to you about H 938. Our comments and testimony are going to be specific to section 11 of the bill, which speaks to the statewide bridge rental assistance program, which we are calling GRAB. And just as soon as Liz can get a connection, presentation that we will share with this committee. Okay.
Okay, Bill. Good work. Okay, so
For the record, my name is Elizabeth Bacon. I'm the Managing Director of Housing Program Administration at the Vermont State Housing Authority. Thank you again for having us today. So as many of you know, the housing crisis in Vermont has really outpaced the federal rental assistance that we've been provided. Only 1 in 4 eligible households actually receive the rental assistance that they're so what they need. And the waiting lists have gotten extremely long. So this lack of available federal subsidies is causing bottlenecks in some of the programs that the state already funds, such as the Vermont Rental Subsidy, VHIP, even affordable housing development, which really relies on these federal subsidies to make the units affordable for the most vulnerable and low-income families in Vermont. And as you know, the emergency responses are very costly and don't create long-term stability, oftentimes re-traumatizing families who are already in precarious situations. So we believe the solution is a state-funded rental assistance program to bridge the gap for folks who are waiting for a federal rental assistance subsidy, but the time is just not right for them. So we historically have been able to offer a move-up preference for folks who are receiving time-limited rental assistance like VRS. And with our funding situation, we haven't been able to issue new vouchers in almost a year. And we don't anticipate that's going to change anytime soon. So this program would allow for rental subsidy for folks to stabilize coming out of homelessness while they wait to come up on the regular Section 8 waiting list. And we know that rental assistance is one of the most effective strategies to prevent homelessness and to keep folks stably housed. It improves stability and also just other outcomes in their lives, health outcomes, and it makes things more efficient. When folks are housed, they can go to work, they can go to school, they can take care of their families a little bit better. Many of the states around us are operating programs like this. They have been for many, many years, just to really supplement their federal funds. And VSHA has been working with the Department of Mental Health on the Subsidy Plus Care program for almost 20 years. And we've developed a great system that relies on the mechanisms that we already have set up across the state for the Section 8 voucher program. And it really becomes pretty seamless for the participants and the owners to participate. So again, subsidies not only help the families that we would provide services to, but also affordable housing developers. Oftentimes funding is tied to affordability or serving specific populations. And if developers aren't able to do that, it jeopardizes their funding. Again, like I said, without subsidy, some of these other programs that are time limited become bottlenecked. Folks can't transition from a temporary subsidy, or they hit that cliff and end up back into homelessness, and that's not what any of us want to see. VHIP, which is a great program, it helps owners update their units and make them up to par for subsidy standards. But oftentimes those families aren't able to afford market rates if they're targeted to the folks experiencing homelessness, and without a subsidy, it's not a realistic match. Excuse me. And again, this would reduce pressures on emergency systems, healthcare systems, all of that. So just looking at a cost analysis, rental assistance is definitely the most cost effective. And I think it's also the most compassionate. It's a way to serve folks and allow them to have their own space. So these numbers are based on the cost of the subsidy plus care program that we have with CMH. And so this is assuming that most households have some income, generally SSI or SSDI. Depending on the population that this program were to serve, those costs are going to vary. So essentially what we envision is a partnership with the Agency of Human Services, where they would determine, or the state would determine, the target population. We would work together to screen those participants and get them set up with rental assistance and housed anywhere throughout the state. We envision no time limits for this program because the funding at the federal level is so uncertain. We want folks to have enough time, those who need a permanent subsidy, to be able to be served through this program while they wait for a federal voucher to become available. Similar to the Section 8 program, folks would pay between 30 and 40% of their income. And then this program would cover the remaining amount up to a payment standard, just like we use with the federal voucher program. And again, this would rely on systems that we already have set up across the state. We have staff that do inspections, that work with local owners and service providers. And so that's already set up, and we're just be building upon that. And then of course we would report back on the success of the program. We really believe we would need a little bit of time to plan and to determine priorities and to set up processes with the state and performance measures so that we're all on the same page of what success looks like. We do think multi-year funding would really make this more successful, especially for owner or landlord participation. If they have concerns about the subsidy ending in 1 or 2 years, it might make it harder for families to find housing. So we feel really strongly that the time limit would be a barrier to this program being successful. And then down the road, I think this would take time to set up, but there's potential for cost sharing from other agencies or departments. So we recognize that this bill is really about responding to homelessness, and it's sort of housed in DCF and OEO's budget. But down the road, we see potential for, Department of Mental Health or Dale to kind of pony up their own funds and broaden this to be an AHS rental assistance program that serves different populations. So again, because of the work that this bill is doing, we envision individuals and families exiting homelessness to be one of the priorities, but also families that are engaged with the child welfare system to support folks exiting hospitals, corrections, or residential care, people with disabilities, including developmental and intellectual disabilities, households that are already on the voucher waiting list, or folks who are receiving time rental assistance already. So the home vouchers, for example. Ultimately, the state would decide, right? So we believe with a $3 million investment, we can provide 12 months of rental assistance for up to 200 households. Again, depending on the population that's determined to be the priority, the cost will vary. So for families, we would anticipate spending closer to $1,400 per household, where that's a single non-elderly or disabled person, it's under $1,000. The bottom line is this is a cost-effective investment. It stabilizes Vermonters. It reduces reliance on already strained emergency systems. And it lowers the long-term costs, both financially and, to the families themselves who are experiencing homelessness. Right, and yeah, we have limited time, so.
Yeah, any questions? Yes.
Thank you, Madam Chair. So mainly section 11, you said?
Yes.
Yes.
So there's under B, program shall be available to the household for not more than 24 months. But then you want the program to go into 2030, is that right? Page 35, it is the intent of the General Assembly that funds are appropriated for the Vermont Rural Rental Assistance Program through fiscal 2030. Yeah, and this is, okay, so you're not asking for any changes.
We we don't support the 24-month time. We don't think that would be successful. For folks who are exiting homelessness, it's generally not enough time to go from, not having your own place to being able to afford market rate rent.
Okay, so eliminating 24 months.
Yes, that's our recommendation.
And there are some families who that might be plenty of time, but I think especially if we're targeting the most vulnerable folks, that they may need more time or they need a subsidy permanently if they're someone that is still.
And you're saying that there's just a constraint on trying to get them re-upped once the 24 month is done. Through the agency of human services. Why don't they look at 24?
Well, because it wouldn't be enough time generally for them to come up on the regular Section 8 voucher waiting list. So if you're someone on SSI,
Yeah.
you can't afford rent without some sort of subsidy. So it might be that it's 3 or 4 years until your name comes up for a federal voucher, which will be permanent. And so we'd like to avoid having someone come from homelessness, be stably housed for 2 years, and then go back into homelessness while they wait for that federal subsidy.
Is there any incentive for them to get off of this program?
I guess not, other than I think the part of the plan with this is case management services and support for folks. But I think the reality is some families will need a subsidy forever. Just with the
Which I
cost of
understand.
housing.
I understand. I just know if there was any incentive.
And that's where, if I may, I think the value of what we refer to as our content preference is really valuable. So working with the agency of human services, the SHA is administering the rental assistance program. We can really manage those transitions from temporary rental assistance to permanent rental assistance for the housing choice.
Thank
you. Anybody else? Thank you very much. Thank you.
Thank you.
That's right. It's on our webpage, correct? So, okay, great. Thank you. Next up, we have Chad Simmons.
To do the dance. I think Alex is.
No, Alex, you're right. Sorry.
That's okay. That's okay.
Appreciate it.
I'm totally flexible.
Thanks, Chad.
Yeah.
All right, I've got some handouts here. Pass along. Thank you, Senator.
Sorry, Alex. I need to do further research.
It's okay.
Okay.
Thank you so much. Yes. One more? Great. We've got another one here. Thank you all so much. For the record, my name is Alex Farim. I'm a policy advocate with the ACLU of Vermont. We are an organization that works to protect civil rights and liberties for people across our state, and we serve as the state affiliate to the national ACLU. We focus on homelessness not only because it is such a massive issue facing our state, but because experiencing unsheltered homelessness places the lives and the rights of impacted people at imminent risk. Homelessness has increased over 300% since the pandemic, with now over 4,000 people experiencing homelessness in our state, including over 1,000 children. And community-based shelter capacity covers as just 690 available spaces. We also know that we have the 4th highest rate of homelessness in the country, and for context, we have the 2nd lowest rate in 2017. For these reasons, we are supportive of plans to create a better homelessness response system in Vermont. We know we can do better. What happens in this room will affect the lives of thousands of Vermonters. We believe that the individual rights and liberties of people with disabilities to live in integrated settings and make their own decision about services and treatment are fundamental. You can think of this as the tagline of our concerns. Over 50% of people experiencing homelessness in Vermont have a disability of some kind. And 62% of folks in the motels last year have a disability. This is a disability rights issue. Our feedback primarily is based on compliance with the Americans with Disabilities Rehabilitation Act, which I will refer to as the ADA, which connected the anti-discrimination policies of the civil rights movement to people with disabilities, enshrining rights to liberty, to bodily autonomy, and the right to live in the community when you are perfectly able to do so and it is your choice. Our most significant concern with H938 is that the tiered shelter system will create segregated settings for people with disabilities where they will be required to comply with mandatory treatment protocols and services or face being unsheltered. A system in which people with disabilities have no choice but to enter those kinds of segregated programs is not lawful pursuant to the ADA. We do not believe that this was the intent of the bill. We believe that it may have been an oversight. And I just want to paint a little bit more picture here and just zoom out for a moment. Our comment really applies when you take the bill components as a whole. It's not that we think specialized shelters are bad. Of course, we know that there are really incredible outcomes for family-based shelters, for recovery shelters, and that having individual services tailored to an individual's needs is important. It's about choice and placement. Because if a person is placed into a restricted setting where in order to stay, they may have to comply with treatment, it's not so much of a choice to engage with that treatment. And the research shows that this is not a good idea. And I want to emphasize this. The language as written appears to force or coerce individuals into treatment, and we don't think it was the intent of the bill. We think that the language needs to be refined to promote voluntary engagement with services. For further context, research on the topic of forced treatment for substance use disorder has widely shown that the practice is ineffective and harmful, heavily increasing the risk of overdose upon the end of interventions. And again, a choice between being unsheltered or forced into treatment is no choice at all. Services should be evidence-based, readily available, and importantly, voluntary. So in sum, our overarching primary comments on the bill ask that it be clarified that services are voluntary, including services for substance use disorder, mental and physical health conditions, that the bill clarify that continuum eligibility is not conditioned on participation in services, and that participation in services is not required to remain in the full continuum. And then clarifying that people with disabilities have a right to receive services in non-specialized integrated settings if they choose. We have more concerns in the handout that I have offered to you all. I won't have time to cover everything here, but please do reach out if you have any other questions. And I just wanted to shift gears and highlight one opportunity for your consideration because it relates to the activities of the bill. In 2025, CMS gave Vermont permission to use federal money to help pay for housing supports for medically vulnerable individuals through a Medicaid waiver amendment. The purpose of this funding is to stabilize people experiencing extreme medical vulnerabilities while unhoused and reduce the strain on our state hospital systems that many people experiencing homelessness rely on for survival. This funding can be used to pay for 6 months of rental assistance, services, including security deposits and other move-in expenses, and up to 6 months of medical respite care in non-congregate settings for people with exiting institutional levels of care who still need clinical services. Vermont sought this funding, recognizing that rental assistance and respite shelter have been shown to improve health of people experiencing homelessness, and it lowers our healthcare costs. Our state accepted the waiver authority, but never implemented it, and it expires in 2027. But Vermont can still act now. The waiver would allow AHS to bill the previously mentioned services to Medicaid and be reimbursed at 58%. I wanted to highlight this here, just given that some of the proposed activities in the bill may relate to this opportunity. We also know that there are unspent funds from program savings from prior years, and we would recommend that those funds go towards this purpose. So thank you for your time. I'm happy to answer any questions that you might have.
Thank you. Questions committee.
Alex, could you sort of give us a rundown of what exactly this is a pretty dense document. Can you just tell us what's in here?
Sure. So the first section here on disability rights covers everything that I spoke about. The new things that I did not reference would be if you go to page 3, due process. We do have concerns around the fraud and misconduct sections of the bill. We believe that the definitions of criminal activity and misconduct are both too broad and vague. Does this pertain to alleged criminal activity? What is the evidentiary standard? Is smoking considered misconduct that endangers the health and safety of others? And so we think this language needs to be refined a bit. I will also say, time limits and capacity. We're in the middle of an escalating homelessness crisis, and we're already leaving thousands of people outside of the equation. And so, we recognize that this bill will shrink the immediate capacity of our shelter system. It's always a concern for ours. We understand that this bill is a negotiation, but it would be remiss for us to not point that out to you all. And prioritization. We recommend that prioritization only apply to hotel and motel usage, and we heavily encourage the committee to use prioritization instead of eligibility. We know that many providers in the community will likely not be able to, serve specific populations over others. And so that's where that recommendation is coming from. One note that I want to make is that we do like things about the bill too. And in particular, the section related to expressed time limits for life-saving circumstances. That is critical. I was at the motels last summer when folks were being unsheltered following the end of the governor's executive order for people with extreme medical vulnerabilities. And what I saw was unimaginable. We were exiting people in wheelchairs, people on oxygen machines, people in active cancer treatment, chronic health conditions that are fatal, and they were exited without even so much as transportation to where they could go next. And so we look at that provision and we see the lives of people being saved through that. And so we think it's essential. We do support, rental assistance funding, and overall we support the effort to improve our homelessness response. Thank you. Appreciate the time. Thank you. Thanks, everyone.
Senator Field, why don't you just take those?
Okay.
But I'm gonna try to read some.
Okay.
One more thing to go.
Okay, Chad Simmons is up next. Thank you, Chad.
Thank you, committee. For the record, my name is Chad Simmons. I'm the executive director of the Housing and Homelessness Alliance of Vermont. We're a statewide advocacy organization, and also the Balance of State Continuous Care organization. I am going to support a lot of what's been said already, and agree. Our organization agrees with a lot of the comments by advocates made to this point already. What we'll share later. We represent more than 60 organizations, individuals, and providers from across the state. And we provide both advocacy as well in state and federal advocacy for housing and homelessness, as well as the collaborative applicant for the Balance of State for homelessness response funding. Today, what I'd like to do is to share some general oversights, and then we'll provide a much more detailed document with specific section recommendations. But just want to highlight some of the sections that we support and encourage to continue including in the bill, as well as a number of areas where we see opportunities for improvement. A couple of just general observations is that we really like that and appreciate the work that's done in the House to codify in state statute a state homelessness response. We feel that it's critical that the state move in that direction, and we really appreciate the work being done already. That said, Senator Morley, I know you had mentioned the previous week around the complexity of what has been laid out after Legislative Council ran through it. We would agree with that. Our providers who have been poring over this legislation over the last several months ultimately feel like the bill as constructed creates too much complexity to be able to operate the services and supports that people experiencing homelessness or at risk of homelessness need. Finally, we have a couple of recommendations on where and which we can make improvements for this bill. I've included for the committee a full slide deck, which goes through a number of the ways in which we got to this point. I think as Alex just mentioned, and a number of providers have shared, that we got here not because of personal behavior or bad actions, but that the system has failed us. And that's the most important thing to think about. We do not have enough housing. We do not have enough housing at the level people can afford. We do not have accessible housing. That is the most important thing I hope you can take away from this testimony. Ultimately, our mission, our goal is to build a Vermont with a fundamental right of housing is joy for all. So I'm gonna skip to the recommendations and observations to Phil, but I encourage the committee to look at the other sections of this testimony to be able to look at some of the data and around how we got to this point. A lot there, obviously. So what the bill does well, what we've really appreciated after our members took a number of weeks to look over it, again, we really appreciate that this creates a systematic way of addressing homelessness, and it creates intent and purpose, and we feel that's really important to codify that in state statutes. And it identifies a number of key priority areas such as prevention and diversion, case management and housing navigation, a diversity of shelter types. And we feel it's really important to articulate the diversity of shelter types that are needed based on individual and family needs. The Bridge Rental Assistance Program, as you heard earlier, this is critical to ensuring people can afford to be in apartments in that bridge to long-term permanent supportive housing. And specific categories of funding and expenditures articulated in the bill. We feel that's really important to actually articulate line item budget and appropriations. And finally, the fair housing appeal, the fair appeals process that was just mentioned. So I have just a handful of recommendations to improve the bill. Last night I had the opportunity to watch the documentary Fault Lines, which looks at the challenges across the country of building affordable housing. And it focuses on a family who is experiencing homelessness in San Francisco and the corresponding NIMBY, not in my backyard activities that minimize and decrease the amount of affordable housing being built. We're experiencing that in Vermont, and it's extremely important to understand the correlation between the lack of houses and homelessness. We think it's important to add that into the bill. There needs to be an explicit section calling attention to the need for the creation of safe, reliable, accessible, affordable housing. Second, we would ask that there are a couple of areas in the intent and purpose section, as well as the definitions, including adding federally already available federal definitions, including continuum of care, and build upon and improve those systems rather than creating a parallel state system. As been mentioned before, we believe that homelessness is not a linear experience, and therefore we believe that the bill should remove any mention of levels in meeting certain criteria for one level to the next. We asked that to clarify the prevention and diversion section so that not to see this as a gatekeeping to other types of emergency shelter. Next, the permanent supportive housing, this has been mentioned already, is a federally defined program, and to clarify that this is not an emergency response system or approach, but rather it comes with case management and should be not time limited. We asked to remove or dramatically simplify the eligibility and priority requirements as it's stated in the bill currently, and to clarify that they not be related to certain shelter types. We do this because we feel like it'll be more effective and efficient if you just remove the eligibility altogether or simplify those processes. Next, we asked to remove or significantly increase the caps. The caps need to be related to people's actual experience, and right now the caps are not in alignment with what people are actually experiencing in the state and the actual need for homelessness response. Next, we want to clarify the merger of the continuum of care, Burlington and Balance Estates is encouraged and to be studied. We welcome that conversation, but just to clarify the language in the bill. The final three recommendations are the rulemaking timeline. It needs to be much longer, and the process needs to be much more public and responsive to public comment. The payment rate structure should be studied only and include specific naming specific shelter providers as one of the partner groups to be involved in that study. And finally, the proposed expenditures, we understand this is a negotiation, and we understand there needs to be some limits. However, the proposed expenditures articulated in the bill do not adequately meet the need of our current homelessness response need. And that budget remains this, if the budget remains the same, we ask that language in each relevant section to be added to plan for or address the lack of funding and the steps the state will take to be able to address those needs. So with that, I'll encourage folks to take a look at the longer piece of testimony, which looks at some of the background research and welcome any questions.
So we could raise the number of issues. Wow. And we heard a little before you about some of the problems and I guess my first question is did you testify in front of the House and what was their reaction to some of the questions that you raised here?
We did testify, and we brought all of these issues to the city. Some of them were met positively and were incorporated into the bill. But we also understand that this is a negotiation with multiple parties, so not all of the things were incorporated. We also understand that the committee ran out of time in not able to fully incorporate all of the testimony feedback. All of those memos and pieces of testimony are both on the committee page as well as on our own website at btjd.org. Thank you.
The second or third testimony talked about the levels. Nobody seems to like the levels. And you just want it based on need then. So each person's independent. You look at that individual and then try to place them that way versus levels. Is that what you're saying, Jeff?
So there's a couple of things in there. One is we actually like the fact that we're articulating and defining what the shelter types mean. We think that's a good thing to actually name in statute. However, there's two issues. One, homelessness does not work linearly, meaning like people don't enter into homelessness or experience homelessness at step A and then go to step B, step C. That's just not how it functions. Second, not every community has all of these levels accessible. So what does that mean? Are we sending people to different parts of the state based on what level might be accessible in one part or the other? We feel it's really complex, and rather than forcing people to go from one step to the other or meet certain eligibility requirements to meet but particular level, just articulate, define the level or the types of shelter, and then based on funding and based on need, then encourage people and support people getting into that shelter category. Thank you.
else?
I just asked that someone sit down with me at some point outside of this meeting room. Because there's a lot going on in this bill, which is great. But I don't feel like I'm educated properly.
We got there.
Okay, thank you.
Thank you.
Thank you, committee.
Next up, we have Brenda Siegel and then Jenna O'Farrell.
I'm gonna attempt that's some policies. Okay. Think if I get to my slides, I asked Lisa, I don't know if you wrote that. I've asked for help because I can't manage them with my eyesight. So. Okay, so good morning for the record. I'm Brenda Siegel, the Executive Director of End Homelessness Vermont. I also will be including a description of our work and a more full set of comments about the bill. But I wanted to just focus on some highlighted things. Just to start though, we are a lived experience led organization that works for the goal of ending poverty and disability discrimination in Vermont and homelessness. We provide a data-driven safety net to the safety net that is trauma-informed and rooted in compassion, empathy, and housing first principles. We have two offices, the Office of Housing Advocate and the Office of Research and Advocacy. You should have some slides from our most recent phase of our study. We work primarily with people living with disabilities who are experiencing homelessness or housing insecurity. So we work with people who are permanently housed as well. For reference, where I'm coming from in my comments, in 2025, we answered more than 3,000 hotline calls. We responded to hundreds of referrals from providers. We were in front of the Human Services Board more than 250 times, actually more than 300 times we've since realized, not with separate hearings, but that's how many times we were there, and over 100 separate hearings. We supported more than 300 people in assisting them with emergency housing or getting housed, and 500 in other capacities, 600 in other capacities. I have to update this. And we worked with providers across the state on all of that. We were able to house in 2025 80 people with complex needs. I think that's important. We remain supporting them in permanent supportive housing, scattered site permanent supportive housing, after they are housed. So they're with us from the point of emergency until they don't need us anymore, which often they will continue to. There are a few areas that I think would be helpful for me to go into more detail for today. And again, including this other chart. As you know, we work primarily with people living with disabilities. We strongly support each and every disability protection named in this bill. Unfortunately, the protections of the American Disabilities Act are often overlooked within our systems by this administration and just within our systems and previous administrations. And it is that leads to many more appeals. It would be a mistake to remove this explicit language that makes clear these protections in multiple sections throughout the bill. The definition of disability should not change in the bill. I understand that may be desired by the administration, but it's really captures the intent of the ADA. And in our experience, that would be the language necessary to capture the reality of who is impacted experiencing homelessness. 6.1% of our clients died from September of 2024 to September of 2025, either outside or within 2 weeks of a hotel exit. Many of those who lost their lives and lived with disabilities wouldn't actually fit in what the administration's proposed definition for disability is. So I think that that's critically important. One's ability to work does not define the risk of their survival or whether or not they will have a catastrophic outcome outside. Medical providers are able right now through a 201 GDR, a special form, to verify a disability. It's okay if we're moving on to a different form of verification, but I think it's important. And we strongly support the adequate length of time that the current version of the bill allows to make this verification. Remember that people have to make an appointment with their medical provider. They have to get to the appointment with their medical provider and submit the form. And then the provider has to fill it out. That sometimes takes some time and some conversation from other providers. The disability section is very well thought out, and to remove it or change it would be a failure of our current, return to failure of our current system. I want to say very clearly that it is every place where it says to the extent of the household's ability, or that is not related to a disability or victimization related to abuse or sexual assault or stalking or equitable access. All of those statements are intentional and clear and important. If we are not concerned about having to follow the ADA, then we don't have concerns about this language. One thing that I have learned in this work is that access and disability rights need to be written into every bill. And with the federal landscape as it is, having these protections written into statute is critical. In light of this, I think it's important to note that in 2211, section 2211 under prioritization 2C, that we add to the ADA, compliance with the ADA, compliance with Vermont's disability protections and law. Under the current federal administration, spelling out rights in statute language is more important. And I don't think that where historically marginalized people are concerned, the rights and protections are currently safe. This is also why it's critically important to leave in the disability language protection definitions and rights throughout the bill. Highly vulnerable people will be put at serious risk otherwise. People living with disabilities have endured at best not being contemplated thoroughly in this system, and at worst being overtly discriminated against. This is part of our work. This is part of our work in Vermont and as Vermonters to address this critical issue and create accessible systems. I have to be honest, not that I ever am not. After all the harm that our organization has seen in the last several years, and considering the endless hearings, which I'll get into in one moment, it's disappointing that we would want to remove any of that.
Brenda, I'm just gonna pause for a second. We're supposed to be done with this portion of the meeting. It's 10 minutes and 5.
Okay.
So you keep going, but just to give you.
Yeah, I will. And I think the research is hard for me to explain in a short, brief time. You can take a look at it. I can explain it separately, or if you want me back to do that, I think it would be helpful to your understanding of this issue. Let me go on the appeals section, because I think that's a really important part of the bill. We have been, as I said, from the Human Services Board many times. So I want to just crush the idea that the appeals are somehow frivolous in nature, and also give some context. We have one where they have resolved in our favor every single hearing that we've done in the last year. Every single one, except in cases where people withdrew because they were housed for some other reason. But I would say that's in our favor too. The appeals have been reasonable accommodation appeals, and the department, to its credit, has come up with a system that has worked, and we haven't had to do one of those in quite some time. Act 27 interpretation, which is when the rules were not promulgated, the department was interpreting the law differently than the Human Services Board said to. We had to do, there were 300 appeals total done, not all by us, about that issue, and everyone was in the favor of the petition. The governor's executive order appeals, we did over 40 of those last spring, and they resolved in our client's favor. And I want to just be really clear about that, because we agree that definitions should be clear, but we also agree that there has to be, or we also would argue that there has to be some ability to work together to resolve these issues prior to hearing. And as one very intelligent woman said to me, there's something right about our system that we are able to go to an appeal and support people through a process so that their needs are met, even if we have to do it that many times. So there'll be more in my written testimony about that. The other places where you'll see in my written testimony that are critically important are the fraud section, the misconduct section, and the rulemaking authority. And I think that all three of those are really concerning to me. We need to be clear about the definition of misconduct. There's already a process for fraud to make it more aggressive, and I'd love to talk to any of you offline about that. Would be harm. And the rulemaking authority is too broad in this, and that's where we've seen some of the harm caused in the past, not the future, as moving forward. In closing, I would say that there are organizations across the state doing this work who are working extremely hard, and this bill has the opportunity to create a more collaborative, more supportive system where the providers are working together with the department. And that's something that we need to see. We need to see an actual shift and change. It can't be that we're going back to the same. And we're concerned that some of the comments that are coming in, not from the folks that we've heard today have been great, agree with all of them. But some of the comments coming from the administration are holding on to a system that we don't think is successful. And so we're hoping that we move forward from that. Thank you, and I'm happy to talk about this offline.
Well, before you leave, Brenda, are there any questions for right now? Yeah. Okay.
You still have the
If,
you still have each other.
yeah, I know. Yeah. Thanks, Brenda. If you will, thank you. It sounds like we could listen to you for about an hour. You're educated on a lot of things.
I tried to come in a little differently today with education and not so much information about the bill, because there were two issues which people don't understand. So
Thank you. Thank you. Yeah, no, go ahead. I don't see Katie yet, so. Go ahead.
okay. Thanks. General Farrell, Executive Director of Northeast Kingdom Community Action, and I'm here today on behalf of the Vermont Community Action Partnership, which consists of SEP, FROG, Capstone, and CVOEO. Together, we cover the United States of Vermont as community action agencies, and we all provide housing services, each in some capacity for the other. Thank you for the opportunity to testify today. H938 homelessness response continuum bill. The active agency's been following this bill closely as it progressed through the House, and we appreciated all the opportunities to offer feedback along the way. We continue our engagement as we work to finish the bill in this committee. I'd like to share some overall positive things we see, as well as strong concerns. I've submitted a longer document that has more specific suggestions for different sections of the bill. On the positive side, this bill clarifies what Vermont identifies as housing services and creates a vision for formal statewide continuum that utilizes prevention support, sheltering, and housing rather than fragmented programs. We support the bill's effort to create housing pathways that recognize no single approach will meet the diverse needs of individuals and families. The inclusion of shelters, permanent supportive housing, rapid housing, shared housing, other models are essential to a response system. I have a question. Is it a continuum or a program? Or a series of programs kind of linked together? Regarding terminology, the bill refers to both the continuum and a program, at times using those terms interchangeably. We believe these are distinct concepts. The continuum suggests a coordinated system of services and supports, while program implies more discrete defined interventions. As written, the inconsistency creates confusion. We respectfully request clarification in the bill. Should this be understood as a continuum of services or programs? In that same vein, the bill describes homeless services as a linear continuum, which you've already heard about from Jack. In practice, the system does not function in a strictly linear way. It's most effective when it offers multiple pathways and entry points, allowing individuals and families to move towards stable housing that reflect their unique circumstances. Emergency shelters play a critical role as a safety net. They provide immediate stabilization in catching people at times of crisis. Well-functioning system requires a range of these safety nets along with coordinated supports that help people move forward. We strongly agree that the most effective approach includes robust investments in prevention and diversion strategies, helping people avoid entering homelessness whenever possible. At the same time, ensuring a full range of options remain available is essential to achieving the best outcomes for all individuals and families. Our primary concern is that, as written, the bill is likely to increase unsheltered homelessness in the near term. We don't have enough other alternatives. The most acute pressure is unsheltered homelessness. This represents the most resource-intensive point along the continuum and requires significant expansion of the state's sheltering capacity to effectively respond. Communities such as Burlington are already at or beyond capacity. Motels currently serve as a critical safety valve and, in many cases, are a more cost-effective option than a shelter. When used strategically, they can save lives and reduce overall systems costs. This is particularly true for single adults with high medical vulnerability, which you just heard from Brenda, who often have limited access to other pathways. The combination of motel caps and a limit on shelter hope or a hotel stay will result in more individuals being forced outside at a time when unsheltered homelessness is already too high in Vermont. Our community action shelters and community resource centers are experiencing the strain firsthand. While the bill emphasizes cost containment and a reduction in hotel use, it risks shifting costs to a more expensive emergency response model, such as increased emergency room utilization and greater involvement for law enforcement during crisis situations. Absent a fully funded resource housing continuum, these impacts will not be absorbed by the system. They will be borne at the community level where providers, municipalities, and first responders are already at capacity. Further, we don't see anything in the bill that would guarantee geographic equity in terms of services and funding, and also the issues the bill is trying to address are capacity issues. Nothing in the bill increases capacity across the continuum. Second concern, community providers and adequate funding. If the intent of the bill is to allow the state to contract with community providers in a flexible manner to enable organizations at the community level to determine the most effective ways to meet both the requirements of the bill and the need for the people we serve, then that approach has the potential to be very powerful. We believe that is the intent, and we would appreciate clarifying language to make that explicit. We also appreciate the bill's recognition of the need for dedicated investment in case management and housing navigation. It is critical that this remains. However, we're concerned that the current appropriation is not sufficient to meet the requirement that all individuals seeking services could even be assigned a case manager. We strongly support rental assistance bridge programs, which provide a direct pathway for homelessness departments has. Ensuring that individuals who are ready to transition to access to this funding is essential to system flow and long-term stability. We also are supportive of increased accountability and data reporting for community providers, particularly tracking long-term outcomes such as return to homelessness and overall system accountability. At this same time, we want to acknowledge that these requirements will increase administrative and operational costs for us as community providers, which are not currently accounted for in the bill. There's also important implementation questions that remain. For example, what happens when an individual or household completes a needs assessment, but there isn't any services or housing available? Will they still receive case management? Do we keep waiting lists? What are the expectations for individuals who are unsheltered but have engaged in an assessment process? Ultimately, the bill will define the role of community partners within the system. We appreciate the strong emphasis on prevention and diversion. As community action agencies, we know that upstream investments can significantly reduce crisis and lower long-term costs. Finally, we support the requirement for a minimum of 2-year contracts for community providers. This will promote staff stability, strengthen long-term planning, and ultimately provide the quality and consistency of services for the individuals and the families we serve in our communities. In closing, I want to draw your attention for a longer document that has been submitted with specific suggestions for certain sections of the bill.
Jenny spoke really fast. Thank you.
I try.
That was great.
Okay,
Thank you.
sorry.
No, it's
So
okay.
you have it all.
We heard multiple times, so yeah, it's good. And we can have your testimony, so thank you. Any questions?
I'd like to talk to you.
I would like to talk to you.
Yeah.
Great. Okay.
Okay, and I guess that's a wrap on H, 9:38, unless anyone has party comments. Okay, thanks, everybody.
Thank you.
Thank
you.
Katie.
Great.
I'm going to.
Okay.
Yeah.
Leon.
services, bill for. That's not. This doesn't go to these things. I don't know
On this stuff.
what our capacity is.
No, I mean, you need like 45, like half an hour.
It should be like a lot.
Yeah, yeah.
Right.
So like.
Yeah.
Yeah.
It's all in your name.
And then it wants to.
I don't know.
We're opening the door.
They started on.
No.
Yeah. Oh.
On the one hand, should I, but I listen.
Yeah, there's anything wrong. You should be told that Anthony blocks.
I don't know. Because people doing this till right now. So this form.
Right.
Changes.
So, yeah. So, yeah.
Nah. It's very close, but it has to be, yeah, we'll look at all of the.
Very so close to me.
We should use. Yes.
All right.
So
So
that.
we can-
Oh, really?
But you have to wait.
Otherwise,
That's.
yeah.
I have. One.
Yeah, great. Yes.
So we're still live. Maybe we could close the door. Turn it, John.
So you like that?
Coming right back.
Maybe leave it.
Before, I'm leaving. If you want to take the front of it.
Understood.
So, I'm not as bad as it, you know. I am. So my, you're good, my jeans. So I have a budget memo. That we talked about today.
Yeah.
And I'm just gonna hand it out.
Want us to have a discussion on in committee on the memo, or how would you like us to handle this?
Yeah, no, I just, right now, I just want you to read it. And then, we can. I'll get your blessing to give it to appropriations. Extra copy.
There is a section.
Okay.
Yes.
Okay.
Uh,
So just, so if you would like. Katie, and Nolan is here to answer questions as well. That's are the priorities that we talked about. First, primary care, and it's more specific because it says how we are going to support primary care through remember per month management payments. It's a continuation of the payments that are currently going on, and it's for 1 year to get over what we call the half year together. Then, second part of that priority is fully funding the paycheck providers loan repayment. Priority 2 was to take away the recommended increases in Medicaid co-pays, which are the recommended co-pays are much higher than what we see in states or medical centers. And then priority 3 was the misuse, substance misuse prevention special fund. And, if that special fund prescription goes in the budget, it's session one, so it doesn't go into statute. So Katie will have some language at some point that we could probably add it into 866. Yeah.
You could put, permanent statute into the budget if you wanted to, but you can also do it through 660.
We don't want to. So that's.
We can do it either way. All right, so that is the memo. And then Senator Lloyd.
Thank you, Chair Lyons.
Are we good with the memo? That's all.
Um,
It's primary care.
Yeah.
And, Medicaid. Days. And it's subject to this year's. Whichever one looks at the money. Define it, what kind of one.
okay. Okay,
So good. That's good, yeah. Show of hands. And you are.
I mean, it's hard because there's so much need and so, you know, but sure, I think primary care can hopefully
Well, if we go through it, yeah,
an upstream, intervention.
it's gonna be going through it. We're gonna see more and more. Let's know as director concierge.
Right.
For practices. Where people are left out. And we're going to see multiple practices dropping. What?
Yeah.
It's a- And it's for 1 year.
You want to show, yes.
I did.
Because regarding that, and we had a discussion about that. They don't recall how significant increases were to the. But
No, I've heard that now, thanks.
Well, right now they have, $1 and $3 co-pays. Co-pays will go up to $4 and $8. And remember that Medicaid patients are frequently diagnosed with no income or very limited. So the choice between paying for their medications or.
Senator Morley, you got a memo for budget on your desk.
Oh.
And we're doing a straw poll to see if you supported those 3 priorities.
Did we?
I do. I don't know about you, I can't speak for you.
So it's the 3 priorities that we have: primary care, continuing their payment per member per month for 1 year. And also to fully fund the loan repayment program.
Okay.
And then the second one was the Medicaid co-pays that restrict people's access. And then the last one, which I said before you came in, will have language that will either put in the budget or in H660 that will permanently place this fund with a description of the fund and that was used in statute so that people are rating it for everything that they do. The significant.
Do you remember the numbers associated with these?
For which,
The per member per month. That was a study for the most part. Oops, as I recall, I'm just going on memory here.
it has, they'll be talking with appropriations
Right.
about how to find the money and how.
Yeah, okay.
Yeah, for the record, Will and I will put this on. So what the administration had proposed, eliminating the per member per month that's being paid through the ACO. I would forget off the top of my head, maybe it's 5 million. I can't remember off the top of my head.
Yeah.
No, it's up there. Sorry.
And that's gross, it's less.
The
And so,
AHAD was, we
AHAD
stored some of the AHAD money, right? Which was.
I think there's 2 pieces. There's the like 500 three pieces. It's like 500 for like admin, 50 for pipeline, and then 667K for loan repayment. That's all the roads. So that's what the governor proposed eliminating.
And the Medicaid one wasn't a I think it's like around 500,000, so about 400
So
something.
both pays,
Yeah.
it's a million,
But
about a million gross. So it's like four something, like
All right.
461
On average.
general fund share. So
Right.
you're
Yeah, I don't have a problem.
okay, but well, the discussion will be where how I haven't asked. I'm not going to ask for additional funds for
I don't blame.
more revenue. I am looking at how we can juggle what's currently in the budget. Their in-laws that will work with us. Be working on it.
I'm sure.
I've already made some suggestions that I will take to the appropriations committee and then see where we go.
Great, wonderful, thank you.
Okay, and now I'm going to do, we're going to serve you.
You're good press.
And
I hope you feel better.
I will be on Zoom.
Okay, and I do need to pop upstairs briefly at 11:30, so I'm just giving you guys a heads up on that. 11:30. Okay, because I'm sharing my shares. Okay,
We'll take a break.
yeah, we can just break or depending on what's happening.
Well, no,
I just need like time.
I think they'll be able to do it well, watch you get it.
Okay, let's see what we can do. So we're on H660. Jamie, you have the floor.
Okay, so we pull up the draft. So we have a new version of 660, changes highlighted in yellow. To refresh your memory, this is the opioid payment special fund appropriations bill. So in section 1, we have the list of fiscal year 27 appropriations from the special fund. A change here that was requested by the Department of Health, in the as passed House version, this subdivision 6 was divided into subparts A and B, and they recommended pressing that all into one subdivision. So the money that was separate in A and B has all been combined, and that's 1.2 million for recovery residence beds. The next change is $800,000 for the Department of Health for distribution to recovery centers.
So.
It's a zero. The same thing.
Yep, there sure is. Thank you.
Yeah.
Like that's.
I'll make sure I get it.
And then, subdivision 15.
These are changes.
Yeah.
Subdivision 15 was requested by the Department of Health. This is 287,000 to DPS to provide funding for expanding the public safety enhancement teams, harm reduction and strategic community intervention efforts. And that's it for fiscal year 27 appropriations. We have this subsection 2 that is amending wording on an appropriation from a previous act. No changes there. In section 3, this is the language about the opioid settlement advisory committee. And there haven't been any changes there since we last looked at the bill. Section 4, there have been changes here. In the House version, there is a paragraph A, a subsection A, and a subsection B. This draft deletes subsection A. And instead, this subsection B becomes the only section in the bill.
Let me tell you what subsection A said. Subsection A required that by December 1st of this year, the Department of Health was to review all previous appropriations from the special fund and make recommendations to the advisory committee and the policy committees regarding which appropriations could be funded in future years by the Substance Misuse Prevention Special Fund. So the proposal from the health department is to remove that paragraph. And then you have this, what had been B, here with some changes recommended by the department. This would read that the opioid settlement advisory committee shall not accept funding proposals from the special fund for fiscal year 28 unless a proposal previously received funding from the special fund. It instead shall review the outcomes of programs and initiatives previously funded through the special fund to assess effectiveness, long-term sustainability, and the appropriateness of the special fund as providing a funding source where applicable. New language from the health department. If funds are available after making fiscal year 28 appropriations recommendations for previously funded programs and initiatives, the advisory committee shall identify specific areas of focus and shall make funding recommendations within those areas based on needs assessments and statewide data rather than requesting new proposals.
So they combine 4 and 5 and make some changes.
What do you mean combine 4 and 5?
Sorry, when I look at, so section 4 and 5 here, but this was appropriation review, and then it was reversions. And now we've got, oh, I see, 6 is reversions, okay. Never
So, in the as passed House version, you're looking at section 4, and what is eliminated is subsection A,
mind. Okay.
which required the department to determine if any previous appropriations from the special fund could come out of substance misuse prevention instead. So that requirement is gone.
Okay.
And then, there's language that the chair just referenced. And that's with regard to the substance misuse prevention special fund. And so the change, so the substance misuse special prevention special fund, is in statute. And this, elaborates a bit about how the fund can be used. So the prevention special fund is established and managed by the Department of Health for the purpose of funding substance misuse prevention programming, including school-based prevention programming. And then striking through this language because it's duplicative. So in statute right now, it says 30% of revenues raised by cannabis excise tax, not to exceed 10 million per fiscal year shall be deposited into this fund for substance misuse prevention costs. So you can see how that is duplicative to what would be added in subsection A. Section 6 has been renumbered. That's the reversion since section 7 renumbered effective date. Those are the changes.
One of the issues I hear often is that invoices take time to be paid, and there's often a lag between when an invoice is sent in to the agency for bill and when it actually happens. Is there anything that's still to come to help the agency now? Questions?
I don't know if he's the best person to answer this or Nolan's the best person to answer this, but just going back to the chart. Giving us, as I interpret revised language. There were 6 programs that were being funded. We got 7 new programs that are coming in. So going forward, we would be having 12 programs that would be potentially funded.
Mostly correct. For the record, all language on fiscal. So this is, I think, the 3rd or 4th year. There have been a lot of programs that have been funded it's only recommended that 6 programs get continued funding.
Okay.
There's lots of programs that are not getting recommendations for funding going forward, and then they're adding those new ones. So that there was only 6, now we're adding 6 more. It was really proposing putting 6 forward. One of those, that was previously funded, the health department proposed putting into base, which the House concurred with. But the idea is that if these programs are successful, you move them out of the special fund and become an ongoing program. So it's a combination of that and then programs that, to Senator Gluck's point, still have money that haven't been fully expended, so they didn't propose funding again because there's still money that hasn't been spent because the contracts are just getting out the door. Then there's some programs that don't need the money, they're done, and there's some programs that they just decided weren't working, right? So it's a combination, whole bunch of stuff. There's a whole bunch of stuff, but over the years, there's been multiple programs that haven't come out. That's all.
It helps. It's just trying to interpret what it says. We're not going to be adding new programs necessarily here. So what are we funding into the future and what included, what's not included? It's kind of difficult to get your head around.
Well, then whatever is funded into the future, it is going to end because this fund is actually going to end
Someday.
someday.
But there's more funding, I think, that's gonna be coming in. Some of it's been built in the base. So. Actually.
Good point. The appropriation diagram there.
Well,
Thanks, Katie. Any other questions? All right, next up, we have, H 657. And our very own Katie, and actually various programming and requirements within the Department of Children and Families.
we have. 11-year-old.
Yep, thank you.
Small ones, 3 pages.
That's a big one. Oh, this is good then. We could probably do this in an hour and be done in less than sure. The senator comes us to me early, you know, so, you know. This is our first look at this program. Yes.
So here it is, page 657. This is an omnibus. It started by taking a number of DCF related bills, and off the wall in human services. And so you'll see that there are a number of different topics covered, all related to DCF's jurisdiction and the, individuals that are in their care. What else should I tell you about this? We have, I'm gonna have a dead batteries. We need to report. Here's the board. Oh, thank you. Wow.
It sits here.
It is, but it's not doing anything.
Oh, wait, I don't think this is how I, oh. That helps. That's fine.
Yep, there we go.
Okay. It was off.
Yeah.
I think in my feeding frenzy, I may have accidentally. Sorry.
Well, I have battery now, thank you.
Before you get going, if I may, one question I always, help when we start into a village, what's the problem we're trying to solve? So we understand why we have this in front of us.
Well, this is a bill with lots of different topics, so I would say that there are probably lots of problems that the committee was trying to solve.
So it's a miscellaneous.
Yeah,
Omnibus.
omnibus.
On the.
Yeah, so there's a reach up, aspect of the bill. Reach up is, the TANF program for the state. And it reduces asset limits. So the problem that you're trying to solve, or the human services was trying to solve, was, I would say, figure out a way for low income people to build up savings for something like a deposit or car. There is a social security program for youth in DCF custody. I did not draft that section. And I think it's much better if you hear from the attorney who did draft it. So I'm not going to cover sections 2 and 3 today. There is a section about certifying runaway or unaccompanied youth. And it allows unaccompanied youth, I shouldn't say runaway, unaccompanied youth. And it specifies who the youth are that we're talking about. But it also allows, if they are certified, allows them to obtain certain benefits that they wouldn't ordinarily be able to receive, or services that they could ordinarily receive without parental permission, like obtaining a driver or learner's permit is an example. So we'll look at that section. After that section, there are a number of conforming changes in other sections to that accompanying unaccompanied youth section. So I'll walk you through those. A lot of them have to do with the learner's permit and the driver's license and the motorcycle license. So we'll go through that. Then we have a series of sections about the transport of children in DCF custody and appropriate use of restraint on those children, when shackles could be used. There is a section on seclusion and restraint of children within DCF custody. Some conforming reporting requirements. Problem trying to be solved there is the state having some authority, or the legislature having some authority and say over what the appropriate type of restraint is on children in certain circumstances. There is a work group at the very end in response to the pregnancy surveillance calendar that DCF had been, or maybe still is, keeping and looking for alternative solutions. So problem there was that there was some discomfort by members of the legislature with that practice and looking for a new solution. So there's no one problem that's trying to be solved.
Common thread is children.
Families and children, DCF, yeah. Okay, so let's look at the language. So first we have section 1. This is the Reach Up section of the bill. As I said, Reach Up is Vermont's TANF program. And currently there is an asset limit that that families really can't build up their savings past an excess of $9,000. So this removes that limit for the purpose of determining eligibility and allows a buildup of assets for families receiving TANF or Reach Up. It's just a straight through.
So,
And we have this sentence: the department shall not impose an asset limit for the purpose of initial and continuing eligibility and for the Reach Up program.
so this was done for a long time ago, as I recall, back when I was here. We looked at trying to get people to save some money. Exactly. I didn't even talk about cell phone. I mean, here. Okay.
I mean, literally.
But, so you stayed off, correct me if I'm wrong, you stayed off the benefits. You were able to save money,
Mhm,
and then up to a certain limit,
mhm.
and then they cut you off as far as the savings portion.
Yeah, if you exceeded that
Right.
asset, that amount of assets, then you'd no longer be eligible. for the
This
program.
is saying, I think, you're still eligible for TANF. You can continue to save and save and save and save and save and save and save.
You would be able to build up your assets. Yeah, without.
That's another great of saying it.
Everything I know. And the benefits are not that great, so. How you save, I guess, you can figure out how to save money on TANF benefits. More power to you, funds. And yeah, I mean, 9,000 good down payment for a car, but it's not gonna get you anywhere.
I was thinking maybe raising it
Yeah,
instead of making it unlimited.
but
I
mean, maybe you could inherit a 20,000 or $100,000 and put it in your savings. Well, it's not the agency. I think savings is fine if it would be something like an inheritance. Or you hit the lottery.
But
Alright, yeah, thank you, Senator. We're keep going.
Okay, so sections 2 and 3 are the social security benefits for youth and foster care. So I'll happily let you hear from my colleague to walk you through that section, 2 sections. Section 4, this is the unaccompanied youth to obtain services without parental consent. So this legislative intent section was added in the House as it started moving from the committees to clarify in what instances this practice would be used and who exactly we mean when we say unaccompanied youth. So in instances in which severe family dysfunction, such as abuse, neglect, child abandonment, or lack of financial support, has left a youth who is 16 or 17 years of age homeless, and other supports such as foster care are deemed inappropriate, it is the intent of the General Assembly to provide an unaccompanied youth with the resources necessary to obtain services and benefits that the unaccompanied youth's peers can obtain with the consent of a parent or guardian. And we have some definitions. Homeless child or youth means an individual who lacks a fixed, regular, and adequate nighttime residence, including a child or youth sharing the housing of other persons due to loss of housing, economic hardship, or a similar reason. A child or youth living in motels, hotels, trailer parks, or camping grounds due to lack of alternative adequate accommodations. Child or youth living in emergency or transitional shelters, abandoned in hospitals. Child or youth living in primary nighttime residence that is a public or private place not designed for or ordinarily used for regular sleeping accommodation for human beings. Living in cars, parks, public spaces, abandoned buildings, substandard housing, bus or train stations or similar settings, or a migratory child who qualifies as homeless because the child is living in circumstances described in subdivision 1.
Problem, so I just encourage you to read that language. That doesn't say the child isn't with their parents. Just says they're living in a campground or they're living in, and then take the parental control away from the parents because the child is living in a campground with their parents. That's what we're intending.
Sorry, keep it right there. So you have to read 2 definitions together. So homeless child or youth is the definition that we just looked at. And then this subdivision 3, unaccompanied youth, means a homeless child or youth.
So you have to pull the two
Yep.
together.
Who's 16 or 17 years of age, who's not in the physical custody of a parent or guardian. Yep, I know, that's a little tricky.
So. You left something out. That is. You won't qualify. I mean, the trouble with giving long lists is it implies that if we miss something, if somebody wants to say no, they can. Wonders if there isn't, like, to me, not living in something designated for occupation, be occupied by human beings. Kind of says it.
Well, it says that in E, right?
Yeah,
Some people do live in Cape Cod.
It's true. Right, all summer long.
Yeah.
They go to Florida, that's their full-time home, right?
so you could add a catch-all, although E is very broad, so maybe that is our catch-all. So C is the certification process. So an unaccompanied youth may become certified if the youth is found by a school district homeless liaison or other appropriate staff person to be an unaccompanied youth, or believed to qualify as an unaccompanied youth by the director of an emergency shelter program funded by the state, the director of a runaway or homeless youth program funded by U.S. Department of Health and Human Services or HUD or a designee, a continuum of care lead agency or designee, the chief juvenile defender or designee, the Vermont Network Against Domestic or Sexual Violence or designee. So those are the people who could certify that the individual is an unaccompanied youth. We have proof of certification. It says Elevate Youth Services Vermont Coalition of Runaway Homeless Services is to develop a standardized form that shall be used by the entities specified in subsection C of this section to certify qualifying unaccompanied youth. The front of the form shall include the circumstances that qualify the youth, the date the youth was certified, the name, title, and signature of the certifying individual, and confirmation that the certifying individual that the individual has completed a human trafficking training in the past 2 years. This section shall be reproduced in its entirety on the back of the form. That means is that the youth has this certified form, and not everyone who the youth presents the form to is going to know what it means. So the statute itself has to be printed on the back of the form so that the person receiving it has the information about what the form does. The department is to post the certification form and information about this section on its website, including who is eligible for certification and which individuals and entities can complete the certification form pursuant to this section. And then we have a list of what the form can be used for. So without the consent of a parent or guardian, certified unaccompanied youth may use the completed form to.
Maybe I'm so sorry to interrupt you. This is a very sad. This is all very sad, actually, talking about this, but is this form, I'm hoping it's gonna be online. Because the teenagers I know are much more likely to have their phones than a piece of paper. I really.
Oh, that the completed form could be electronic.
Yeah.
I was thinking.
Doesn't say that, but that's.
You gotta walk around
with a piece of.
Yeah, we definitely need to have that.
Gonna get pretty bad.
Or a photo of the form or something like that.
The photo.
What they do now, like with fishing licenses and hunting licenses, you just take a photo of it.
Yeah.
Then you don't have to carry it on.
Yes, it probably should be a photo with a kid on it. Otherwise, you could braid it off. Do your buttons. It's pretty.
There, thank you. Okay, so this is the list of what you can use the form for. To apply at no charge for a non-driver identification card, a learner's permit, or an operator's license or operator's privilege card. To obtain a vital event certificate at no charge. To consent to care by a healthcare professional licensed or certified in Vermont, including medical care, dental care, mental health services, including psychological counseling and treatment, psychiatric treatment and substance use prevention and treatment services, and surgical diagnosis and treatment, including medical diagnosis and treatment, such as preventative care and care provided in a healthcare facility. Or the youth themselves or the youth's child, if the certified accompanied youth is unmarried, is the parent of the child and has actual custody of the child. In subdivision D, enter into a contract for housing or obtain admission to a shelter or transitional housing. use the form to obtain employment pursuant to Title 21. To purchase an automobile and obtain automobile liability policy. To apply for a student loan. To obtain admission to high school or post-secondary school and participate in school activities, including extracurricular activities and field trips. To open an account at a state or federally chartered bank or credit union. To receive services for victims of domestic or sexual violence as appropriate. So that's what the board could be used for. Then subsection E, a healthcare professional shall accept the completed form as proof of the youth's status as a certified unaccompanied youth. Entities that provide housing, services, or benefits authorized under the section may keep a copy of the form or card in the youth's medical file. And then we have this language in F about consent to a parent or guardian. So a certification issued pursuant to the language we just looked at is to authorize the unaccompanied youth to obtain benefits for services listed in D. A person, provider, or healthcare professional shall not require consent of a parent or guardian as a condition of providing a benefit in D. And then for the purposes of implementing the subdivision D21 or I, which is the opening of bank account. The Commissioner of Financial Regulation shall ensure at minimum youth certification requirements are met for the purpose of making it legally permissible for bank, credit union, or insurance company to contract with the unaccompanied youth without a parent or guardian, and with understanding that the unaccompanied youth may not have a permanent physical address. In subsection G, immunity for liability, any entity, provider, or healthcare professional. Sorry, I have a big thing across my screen that says my internet.
You have a different version.
Oh,
Lost it there for a minute.
did you print the one no, that's okay. That,
Because the booklets on the.
yeah, okay. So there is an error in that version because of the order that the amendments occurred on the floor. So I have produced this version, draft 1.1, that fixes the timing error. That is the only problem. That's the only problem with that. So once we get through the next section or two, we should be. This captures what the intent of the order of the amendments was.
Okay.
So we have immunity for liability. Any entity, provider, or healthcare professional who relies in good faith on a certification form presented by a person who claims to be certified unaccompanied youth pursuant to this section shall be immune from liability for such reliance unless the entity, provider, healthcare professional acted with gross negligence. So this is pretty much saying if you're relying on this form in good faith, then you're immune from liability. And then language that nothing in this section shall be construed as altering an existing compact for the interstate compact for juveniles that Vermont is part of. So that's it for that section. And then page 11, section 4A. There is language and statute that the judiciary team made me aware of as Human Services was working on this. That says a person commits a crime of unlawfully sheltering or aiding a runaway child if the person knowingly shelters the child, intentionally helps, aids, helps, or assists the child to become a runaway, etc. So there is some thought that because one of the authorized activities was to provide shelter, allow a child to consent to shelter or obtain housing, that there would be a conflict. So there's a little bit of a carve out in C1 that says exempt from the prohibitions of this section. You jump down to 3, a person providing assistance pursuant to the section we just looked at. And then there is a catch by the Judiciary Committee as they were reviewing this, that we don't want to exempt anyone who is knowingly taking, enticing, or harboring a runaway child with the intent of committing a criminal act. So These parameters were put in that the exemptions only apply to B1 and B2.
I was on tuition here when with this, you know, there were swamp houses, there were places that were deliberately sheltering from white kids. And it was a serious consequences.
Yeah, so this kind of oversight has been on the books for a long time. So this will hopefully tighten that piece up. And then, as I said, there's a series of sections now that are conforming sections with the unaccompanied youth allowances with the certificate. So first, there's a section on vital event certificates. And this says the state registrar shall waive the fee for certified copies of a vital event certificate issued to an unaccompanied youth who has the certificate. That
Already done.
birth certificate, I think.
That's it.
Well, it could be a death certificate, it could be a marriage license.
Okay.
But yeah, I guess it would be a birth certificate to get a driver's license or something. Section 6 is a non-driver identification card. And scroll down, subdivision 3, the commissioner shall require a fee of $29 at the time of application for this card, except an initial non-driver card shall be issued at no charge to, added to that list, an unaccompanied youth with the certificate. Same thing for the license and privilege cards. Where's that? Subdivision E1, an unaccompanied youth who has obtained a certificate shall be provided with an operator's license or operator privilege card at no charge. No additional fees for motorcycle endorsement.
Yeah.
Oh, I'm sorry.
14.
Okay, section
We're
8.
only 14.
Sorry, I'm moving
No, no,
fast.
Middle of 14 is the new
Thank
thing.
you. Yep, you want, yep.
Learner's permit?
Yep.
Okay. So again, kind of conforming concept here. The commissioner shall require payment of a fee of $24 at the time the application is made, except that no fee shall be charged for an unaccompanied youth who has obtained that certificate. Same thing here, the fee of $11, except for an unaccompanied youth who has that certificate. That's for the motorcycle. 3, motorcycles learner permit, same language, the fee, $24 fee doesn't apply to the unaccompanied youth. D1, $24 fee doesn't apply for the learner's permit. Okay, I'm on section 9. So you can follow along with your page numbers. Got it? Okay. So we're changing topics now. So that wraps up everything on the unaccompanied youth. And now we're changing gears to look at language about transportation of a child. So the next few sections are pretty dense. So we have a series of definitions. These definitions, you have a lot of cross references. So we will see those definitions in a later section. But we have a definition of least restrictive, mechanical restraint, physical restraint. Secure transport means transport in a vehicle with disabled internal controls for rear door handles and window switches, requiring the driver to open them from the outside or with a safety partition installed to separate the driver from the passenger compartment. Secure transport includes any vehicle being driven by a law enforcement officer. We'll look at the definition of soft restraints elsewhere. Waist shackles means a mechanical restraint device, typically a chain used around the waist to which the child's wrists may be chained or bound. Okay, so we're making amendments to existing law. So in subsection B, this is amending existing law. The commissioner for children and families shall ensure that all reasonable and appropriate measures consistent with public safety are made to transport or escort a child subject to this chapter in a manner that current law is reasonably avoids, this says prevents physical and psychological trauma, respects the privacy of the child, and represents the least restrictive means necessary for the safety of the child. Subsection C, the Commissioner for Children and Families shall have the authority to designate the professional or law enforcement officers transporting children and shall authorize the method of transport. A contract for transportation services shall include the requirements of this section. Transportation services with non-contracted law enforcement officers shall only be authorized in emergency situations or by court order. That brings us to D. The Commissioner is to provide educational materials complying with this section that outline the legal requirements for the secure transportation of children to individuals designated pursuant to C, and shall obtain verification that all designated individuals have reviewed the educational materials. In subsection E, secure transport shall only be used when the department determines and documents why it is necessary to prevent the risk of serious physical harm to the child or others based upon an individualized risk assessment. In F, it is the policy of the state that mechanical restraints are not routinely used on children subject to this chapter unless circumstances dictate that such methods are necessary. Existing law. New language. Soft restraint shall be the first option for a restraint, and other mechanical restraints shall not be utilized as a substitute for soft restraints if the soft restraints are deemed adequate for safety. Subsection G, an entity contracted pursuant to C shall provide documentation to DCF for the use of restraints when the entity believes that the risk of serious physical harm to the child or others requires the use of soft restraints before or during the transport, including a description as to why less restrictive interventions could not reasonably be attempted, or why the attempted use of less restrictive interventions was unsuccessful. When the entity believes that the risk of serious physical harm to the child or others was such that soft restraints were not adequate for safety, and shall include a description as to which restraint was used and why soft restraints were deemed inadequate for preventing risk of harm, serious physical harm to the child or others, or the use of waist shackles was determined to be the sole means of preventing serious physical harm to the child or others, and shall include a description as to why waist shackles were the sole means of preventing the risk of serious physical harm to the child or others.
Did it say, was it defined, I think it was soft restraints?
We're all cross-referenced in another section that we haven't got to yet, so
Sorry.
no, that's okay. I know it's important for understanding this section and the other section, so we'll spend some time looking at those. And subsection H, documentation for the use of restraints, shall be completed prior to transport unless circumstances that required their use occurred during the course of the transport, in which case the documentation can occur after the fact. In subsection I, the use of waist shackles shall be prohibited on children 12 years of age or younger. The use of waist shackles on children 13 years of age or older shall be assessed and determined to be the sole means of preventing serious physical harm to the child or others, and documented accordingly. Only designated law enforcement agencies shall use waist shackles on a child transported pursuant to this section. The Commissioner is to ensure supervisory review by the department of all documentation required by this section. Then we have an annual reporting requirement in subsection K. Annually by January 15, DCF is to submit a written report to the policy committees, the Office of the Child, Youth, and Family Advocate, addressing the number of secure transports of children during the previous year, including for those transported with restraints, the age, gender, and racial background of the children transported, the number of children transported using mechanical restraints, whether the transport was conducted by law enforcement or a private agency, when applicable, the type of mechanical restraint, the type of custody children were in when transport occurred, and the purpose of the transport. And in subdivision 2, once the department has upgraded its technological capacity in a manner that enables it to collect responsive data, information specific to subdivisions B, C, E, and F above that I just went over shall be collected and included in the annual report with regard to all secure transports. So right now, that data isn't necessarily available. Subsection L, annually by January 15, the Department of State's Attorney and Sheriffs shall submit a written report to the Policy Committee's Office of the Child, Youth, and Family Advocate addressing the number of court-ordered transports of minors conducted by the state transport deputies, including date of birth of the transported minors, whether restraint was used during transport, if restraint was used, the type of restraint, and whether the minor's case was a delinquency, youthful offender, or criminal proceeding, and the purpose of transport. And the two different reporting criteria, my understanding is that the way that the different agencies collect the data is different. So it's meant to reflect their current practice of how they collect data and what categories of data they collect. Okay, section 10.
These charts, since we're having to end at 11:30 today.
Yeah,
Wonder if we could do the rest of the bill pretty high level so that we can hear from.
definitely. John is here to do sections 2 and 3, but we've already kind of moved past that. Do you think that it's better for him to come back another day since we still have?
I think so. Is that okay?
Is that okay?
I love that.
Okay, thank you.
Goodbye.
We'll get back.
Sorry. That's one question.
Yes.
In this part, did the Department of Corrections over Department of Public State, they testified, no, it's curious.
I'm not always in the room. Well, you have a message. Oh, yeah, you're still here. Sorry, I missed that question.
Get them in.
Well, I just wondered whether
Questions
they
whether
had weighed
DOC
in
and DPS.
on some of this or not.
I don't believe so. My understanding is this, that this part where on the transportation.
You're on 9. Yeah.
Yeah, wasn't that because it's not like,
Like DCF has to be.
yeah, but it's not so much like judiciary, more, we had like the state's attorneys, I'm trying to remember, we've had
That's okay.
multiple like related bills, yeah.
Yeah.
We're gonna look at our.
I've got Melissa could pull up Phil. She's already doing that. Okay.
Yeah,
Let's
okay,
pull
I
up
was gonna
those.
pull that up too, yeah.
Okay. Okay, section 10, this is a report on the restraint of children during transport. So this is a one-time report coming in December of next year from DCF, 2 policy committees. Topics include contracting with law enforcement, departmental oversight and supervisory review of secure transport, mechanisms used by the department to collect and review data on the application of mechanical restraints, materials and requirements for designated contractors, written policies to effectuate the law, other information the department deems relevant. So that's the one-time reporting. Section 11 is a use of force policy. This is tasking the Criminal Justice Council in consultation with various other entities to conduct a review to determine whether its use of force policy should include an appendix to adequately address the transportation by law enforcement of children under 18 years of age that is in alignment with the public policy considerations for transport of children in the statute that we just looked at. Okay, so that was all transport. Changing topics again. Section 12 is non-transport related restraint and seclusion. Here's your definitions. So most of the definitions in the last section were cross-referenced to this section. So when you're asking about mechanical restraint, soft restraint, those are listed here. You want me to move faster, so I won't spend time there. Okay. And subsection B, this specifies that the department is not to use or authorize prone restraints, mechanical restraints, chemical restraints, or strip searches on a child. And subsection C, seclusion and physical restraint shall not be used for punishment, disciplinary purposes, the protection of property, or any other reason other than as a safety measure of last resort to prevent serious and immediate risk of harm to child or others. In subsection D, a staff member shall use other restrictive interventions unless less restrictive interventions have failed or would be ineffective at stopping imminent danger. Subsection E, after attempting to use less restrictive interventions, a staff member trained in accordance with the rule may physically restrain a child or place the child in seclusion after the member first takes these 3 steps. Determining if the behavior poses a serious and immediate risk of harm, conducts physical restraint or seclusion in a manner that respects privacy and limits physical and psychological trauma. After the initial intervention, the individual explains to the child the reasons for the restraint and informs them of the circumstances that allow release. In subsection F, if the child is placed in restraint or seclusion, the child is to be released immediately when there's no longer that risk of harm. Subsection G, restraint or seclusion lasting more than 10 minutes requires supervisory approval and oversight. If it lasts more than 30 minutes, it requires clinical and administrative consultation, approval, and oversight. The child shall not be held for more than 1 hour in restraint or seclusion without an in-person assessment by the clinician and authorization by the administrator on duty. The child in seclusion shall be provided constant uninterrupted supervision by staff. Subsection H, nothing in this section shall be construed to include a locked bedroom during regular sleeping hours at a secure residence as seclusion, conflict with any law providing greater additional protections to the minor. Subsection I, notice of the use of one of these techniques while the child is in the department's custody, goes to the department, the child's parent or guardian ad litem, child's attorney if applicable within 24 hours. Subsection J, program or staff member who's using one of these techniques is to document and provide a copy of each recorded use of seclusion or restraint, including a copy of audio or visual recording to the commissioner. Upon request, audio or video shall be provided by a secure means of transmission, blurring other children to protect their identity if they're not in the custody of the department. And the department is to include a description of the child's specific behaviors that justify that intervention. The department is to complete documentation, forward the documentation to the Child, Youth, and Family Advocate. Subsection K, department is to collect the following data on the use of seclusion and physical restraint by placement type, program name, age, gender, racial background of the child, and it will include specific types of seclusion and restraint used, length of time that the child was secluded or restrained. Subsection L, prior to contracting with any program for the care of a child in the department's custody, the department has to conduct a review of any records from the prior 5 years regarding the safety of children in that program's care, including any violations of licensing status, etc. In subdivision L2, the department shall remove any child from risk of harm and initiate a search for alternative providers if an out-of-state residential provider is determined to be in violation of the standards of the contract with regard to licensing and exclusion. Restraint and exclusion. Subsection M, a child detained in secure residential program may be restrained with mechanical restraints for a momentary initial hold to enable the relocation of the child to a less restrictive method of intervention if necessitated to prevent serious immediate risk of harm. procedures and standards established under this section include notice and reporting. And also notwithstanding B was sort of the blanket statement, we can't use these restraints. A child detained in a secure residential program may be subject to a strip search if a pat search has led to probable cause to believe that the child has possession of contraband that poses a threat of serious bodily injury to the child or others, and the child has refused to voluntarily turn over the contraband. The child is given an opportunity first to relinquish the suspected contraband, whereupon the search is discontinued. Notice and reporting shall be the same for seclusion and restraint. Body cavity searches shall not be permitted under any circumstances. Subsection O, the department is to post on the family division scorecard online or other prominent location the rates of restraint and seclusion used by children in its programs. In subsection P, this is a rulemaking provision. The department is to develop and adopt rules in consultation with stakeholders, including requirements for staff training, supervisory oversight, record keeping, reporting, oversight responsibilities, and any other necessary standards. Section 13 amends a section we just looked at in the previous section at a later date. So this is amending subsection L of the section we just looked at, but a few years later. So it's adding this subdivision 2 that says when contracting with an out-of-state program, the department shall include a requirement the program adhere to the provisions of this section. Okay, section 14 is a report about children in correctional facilities. So by January 1 of this coming year, DCF and corrections are to submit a written report for the policy committees regarding use of restraint and seclusion on minors in DOC facilities and potential means of reducing physical and psychological trauma and restraint. In preparing the required report, the department shall consult with a work group composed of lots of stakeholders. I won't read them all to you in the interest of time. Members of the work group are not participating in their professional capacity, get a per diem and compensation. That brings us to section 15, proposal to extend supports for children over 17 years of age. By November of this year, DCF is to submit a written report in consultation with the judicial branch to the policy committees with recommendations for a court oversight process that meets federal requirements to allow access to federal funds for programs that may support youth up to 21 years of age and that ensures sustainable use of judicial resources. The report shall include any recommendations for legislative action. Last substantive section, I think, section 16. This is the prenatal engagement and family support working group. This creates a working group with the purpose of examining DCF's current practice of using pregnancy calendar to monitor and track certain pregnant individuals in Vermont and provide recommendations on alternatives to a pregnancy calendar and ways to support pregnant individuals in need of services. B lists the membership of this group. C has the powers and duties of this group, which is essentially the purpose of the group. Assistance from DCF, report November of this year to policy committees, specifications about meetings and selecting a chair, what constitutes a quorum, compensation and reimbursement for members who are not otherwise operating in their professional capacity. And then we have effective dates that are tiered. We have a number of provisions taking effect on passage. Section 9 and section 12, which are the secure transport and seclusion and restraint, are January 1, 2027. Sections 2 and 3, which are the sections you didn't hear today, July 1, 2027. Section 13, which is that one piece that takes effect at a later date. That later date is July 1, 28. All remaining sections take effect July 1 of this year. Yeah.
I think we're gonna hold our questions maybe for next time, just because we're running out of time and we have to finish early today. Apologies, everyone. Yeah, Nolan up next.
Do you want to hear from?
Yeah.
Deputy Commissioner since he's here and,
And we can hear from you next time.
exactly.
Yeah, so that would be great if we could hear from the deputy commissioner. And the director of communications. Yeah, would you like to come up and have a share? There's no chairs there.
I can stay.
Yeah, that's okay.
Thank you so
Yeah.
much.
Wonderful, thank you for being here. Have you all met everyone on the committee? We can quickly go around the table. Senator Wilkie.
John Roy, formerly.
John Benton from the Orange District.
Robbie from Chicken Second. In Cummings, I think we met sometime. But it's been fun.
I know you're short on time, so I'll try to be brief. Thank you for your time here. For the record, I'm American Deputy Commissioner of Family Services Division, and I'm trying to.
Sure. Hi, everyone. I'm Pam Marble. I'm the Director of Communications and Legislative Affairs for DCF Family Services.
I know you just had your walk, and there's a lot there to take in. So I'm not sure if you had any specific questions for me now, or.
A lot of little questions, and I think, I don't know, today's the day, but, one of the things I had asked, I had written down in my booklet here was, just thinking about the transport of children and then, the restraints and so on and so forth. I'm, you know, and this is such a delicate matter, right? Talking about a strict search of a child, which I know is not done unless, you know, there are certain conditions, but is it in statute or is it standard practice for there to be an advocate along with that child in a room when this happens? Just as an example.
Generally, there would be a worker in there, or, you know, they wouldn't be alone with just law enforcement.
Okay.
But I'm not certain if it would be an advocate. And he's had practice in the field.
Yeah, I will say that's very rare. That occurs only in the most serious of times and settings. If there's immediate harm to that child or youth or to another child or youth. So I will say it's very rare, and my understanding, I defer to Tyler Allen's expertise, who manages that part of our work, and is really just quite the expert on those topics. I would defer to him and recommend to the committee that he comes in as well, and if there's more the need for the nitty gritty information on that. But it is never just one individual in room alone with the child, and that's great.
Thank you.
How many cases are we talking about any years? On average?
How many kids are transported? I'll have to get back.
No, I mean,
Oh, it's like.
it'd be a lot of them.
No, it's not a lot of them, definitely not for secure transport at all.
Okay.
The vast majority of our transports are, you know, casings or workers taking kids back and forth to school or doctor's appointment where there's no type of.
Right.
Secure transport.
And then there is some training in here, for that. And it really doesn't say if you have to do it annually or what, but it's advocate. So the consultation of stakeholders in this section, including the partners of staff training, standards for supervisory oversight, record keeping, a lot of record keeping, and reporting by residential programs oversight as well as the environment. So there'll be more work, and more training. Sounds like. It's if you're not doing it that often, I don't know how often you're going to train.
I still think even though it's true, it's not going to be done often, I think given the serious nature of any time you need to have a child restrained, you should have regular training.
Yeah.
So that it's done with.
So just in your observation, what's written here and what you see in actual practice, is this really codifying what's actually done currently, or are you seeing things that?
It's actually, we're very much aligned with what's in here, and Tyler has worked a lot with the committee to sort of get on what the actual practice is. The only area where we do diverge is where the part of the bill where they want these types of restrictions to be placed on out-of-state residential facilities. And that causes a problem because, you know, we already have a difficulty finding out-of-state facilities for our kids. If we don't have no mechanism to actually have them forced.
Right.
These policies.
Outside.
And then that might cause a situation where we're able to actually have our kids when they need to go out and state, have the appropriate facilities. So that was something we did. We did want to be glad and take it.
This would include children with Jason.
I mean, any child that would generally, if this child is having a situation with autism, I'm thinking that's not the way we would feel to address. This is usually for kids that maybe do not justice related and have issues. I can't say for them, but if we really do take an approach that takes a look at the child holistically, if there are other ways to handle the situation. That's what we're asking law enforcement to do.
Some of the most heartbreaking testimony I've heard is parents, primarily adolescent males, because of their autism, can't be compressed and they have reached a physical size where they're dangerous. And having these kids taken out, either strapped to a stretcher or in handcuffs. And I think it was the out-of-state placement, because we don't have an in-state place. And it's pretty much.
And I think it does turn on safety to the youth and safety to others too. So that there is a situation where that is at play. Law enforcement officers are going to try to take it. But it's really, that's the least, that's the farthest down the road.
My only other question was around the certificate. It's not specified here that it has to be like hard copy, paper copy, or it can be on a phone, or it could be a photograph of the certificate.
This is another.
Oh, yeah, not for you.
Yeah,
I can chime in on that. I don't know if that would be something that's established in rulemaking or that different process. We, as family services, are not named as a certifying entity. That was a purposeful choice. We recognize that when there is overlap with our department, that potentially takes away what I assume was the committee's intent behind allowing those young folks to have some independence and be able to navigate their circumstances in a way without system involvement.
Yeah.
I do know that the Department of Health was interested in speaking to some of the vital document or the vital records areas. There's a bit of a chicken and egg effect that they've brought to our attention. So they may be interested in coming in and speaking to that topic as well.
great.
Just to clarify, what we're talking about on the transport and housing is only when the child is in the Department of Children and Families custody.
Yeah.
Right, not outside that. Put words in your mouth, which I don't really want to do, but the real concern you would have, if I heard you correctly, it's not what we're doing here in Vermont, but when we have to send a child out of state, that we want to make sure it's in statute to protect them.
Well, what we want to make sure is that the statute that would be governing the children in Vermont isn't extended out to having us necessarily say we can only contract with people that follow this law, because we don't have necessarily the teeth to make sure they're actually following it, right?
That's good.
There's very few.
Yeah.
We're still trying to recite which. Nobody wants completed fall in their neighborhood.
It's, we're still wrestling with where.
Yeah. And-
So it's a big problem.
So,
I'm just trying to make
yeah,
sure I
no, I mean,
understand what we're
it's really
trying
a
to
rock in a
accomplish.
hard place.
Yeah.
It exactly
Yeah.
is. It is.
Well, time is short. The other pressing
I don't see
issues
here.
today.
You're okay with Bill and Jeff?
In general, yes, but that part definitely.
That part.
And then there's some issues about social security that we did want to talk about and have to talk about it now or come
We
back.
haven't even gone through that section. We're gonna get John, Fletch Council to go through that, so maybe another day.
I'd love to.
Like it, we can look at it.
Yeah, okay, you wanna give us a brief flag, I guess? That's what they're showing. I'm sure.
The issue for us with social security is we've been looking and trying to not have benefits, survivors benefits and, SSI benefits. We use those directly here for the job as benefits. We don't sort of pool them with other children's benefits. What comes in from the credits goes directly for that child to get. At this point, we're not using the social security benefits. It's $812 million budget deficit we need to finance the bill. So we are interested in not using these benefits, but we want to do it in a way that's deliberate and sort of takes into account that you can't do it all in one fell swoop and actually manage our budget at the same time. We've been looking at perhaps doing it age related, where we start with 17-year-olds, because those are the kids that can rate takes it out here. It might be nice for them to have a nest egg, or even the percentage for over a span of 5 years, rate would take. Then we're not having utilizing any social security benefits, but we're doing it gradually. And then there's the issue of there's social security, there's survivors benefits, and there's SSI. And in this bill, they combine the two. But they're really two separate, different programs that are administered differently. And to have us try to not untangle the two of them makes an additional administrative burden on us. And when you're thinking about the feds, who suggested that states stop doing this practice, the feds are only looking at SSI benefits. And this is sort of combined with two, which would be even more a request that even greater than what the feds are suggesting.
Absolutely. If you'd be willing to put all of your wonderful ideas and thoughts into a document, send it to Calista. That would be great.
We're going to actually mark it up to sort of talk about how we would suggest it, because we absolutely agree that the funds should be passed on to the kids. We just want to do it in a way that's responsible.
Yeah.
That makes sense. Did also submit a memo, with a lot of this, just a high level overview of all of the topics that we, would like to discuss with you all and share our perspective on. I believe that was submitted earlier this week, late last week. I'm not quite sure when it actually got to you all, but that does give a high level overview of our thoughts on the specific topics as well.
It went out on the 13th.
Great. We'll make sure it gets posted, and I know that Deputy Commissioner Gray is, I think, on the line with us. We're out of time, unfortunately. We had to shuffle some things due to illness, and could we have you back in another time?
Absolutely. Yes. Happy to come back when it works for you.
Wonderful. Well, thanks everybody for being here today.
Thank you for your time. And if you do end up having questions after you submit the write up to please, I'm more than happy to come
I
back.
think we will. So thank you. Much appreciated. I think we can adjourn unless anyone has final thoughts.